Info for patient.
Insight into Vertigo. We are delighted to welcome you all as we'll explore the key insights and also share expertise on this very crucial topic, vertigo. Now, before we proceed, I would like to call upon Dr. Suhaib for the recitation of Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إنما المؤمنون إخوة أخويكم واتقوا الله لعلكم ترحمون सारे मुसलमान आपस में भाई भाई हैं बस अपने दो भाइयों में सुलह करा दिया करो और अल्लाह से डरते रहो ताकि तुम पर रहम किया जाए सदक़ल्लाहुल अज़ीम
country to share our current cases and learn from it. So now I would like to call Dr. Sarfaraz Latif to present the welcome note and introduce our guests.
Respected teachers, dear colleagues and residents, Assalamu alaikum. Me and my department welcome you all in this symposium on vertigo. I am really honored and blessed having a collective of outstanding and learned professors among us today. I'm also thankful to all the participants who joined us on our YouTube channel, Insta and Facebook page. So let me introduce shortly our guests. First of all, I will introduce Professor Azhar Saab. He is a renowned ENT teacher and a great ENT surgeon. Professor Saab was awarded Best Award of the Excellent Teacher by HEC. He is also Professor of Emeritus, and few years back I met a professor at Bahawalpur, and at that time almost all the Department of Punjab were headed by the residents of Professor Zarmisa. So he has long legacy of teaching. So his legacy of teaching is continued from generation to generations from his students. Thank you, sir, for joining us. Our second speaker is Professor Khalid Cheema Saab. Khalid Cheema Saab is very decent and very polite person, and we used to meet most of the time at UHS making MCQs and papers. He is true academician professor. Thank you so much, sir. Professor Tahir Shih Saab is my dear friend and very senior colleague. These days we are working on Rhinocon also. He has worked a lot for ENT specialty. From the last 1 year, he has arranged so many ENT meetings, almost in the all departments of Lahore. So he is always available for ENT. Dr. Khurshid Alam, he is my elder brother and my senior colleague from Doctors Hospital Lahore. So he is a skillful and highly learned ENT surgeon. I myself learned a lot of tips and tricks in decision making in difficult cases. Thank you so much, Dr. Khurshid, for joining us. So today the topic of our symposium is vertigo. So many years back, when I was preparing my FCPS Part 2 exam, I attended a lecture at CPSP Karachi. So there was a Professor Kamaluddin. So I remember his few words about vertigo. He told at that time that vertigo is underdiagnosed problem in Pakistan. So in other words, he said at that time that vertigo is underdiagnosed and overtreated problem. So with the passage of time, I realized that his statements were true regarding the vertigo. Because in the vertigo, the patient present with different scenarios. Some patient complain that he is revolving around the environment is revolving around him, the earth is slipping, head is falling back. So there is a diversity of these symptoms. So most of the time on clinical examinations, you are unable to pick any positive finding, because most of the patients, when they present to ENT clinic, they are taking the labyrinthine sedative drugs. So it's a very difficult problem and has always some pathologies lying behind the scene. So we have arranged this symposium, and I am sure all these learned professors will deliver a very informative and very informative lesson for us that will help us in the management of vertigo in coming days. So let's start with our program. So Dr. Sama will proceed further. Thank you, sir.
Stage, our very respected guest, Professor Khalid Cheema, who will not only enlighten us about the physiological basis of balance, which is a very fundamental concept on understanding vertigo, but also teach us about its management. Thank you, sir.
You could all join this wonderful, amazing, and pleasant morning, which is an academic too. I'm also feeling that a gratitude should go to the organizers, Professor Sarfraz and his team, for not inviting us, rather arranging such a wonderful academic morning and choosing a topic which really we all believe that it demands a lot of discussions, debates, and revisions and reviews and whatever. So before I proceed with the presentation, I really feel blessed and honored and short of words when I see my all teachers sitting in front of me. So I'm a bit nervous and shaky to talk in front of them. Whatever I learn, jo bhi hai, we are because of them. And I'm again honored to an extent, to the best extent, that one of my teacher, my great mentor, an exceptionally great personality, and he has blessed all of us by his presence here. So सारे teachers हैं, नजम साहब हैं, मंजूर साहब हैं, मुजीब साहब हैं, but I am talking about one and only our great teacher, Professor Amir. मैं सिर्फ ये कहूँगा कि जैसे अभी सरफराज ने कहा, ग्रेट सर्जन, वंडरफुल पर्सन, बट मैं उनकी प्रेजेंस में सिर्फ ये कहूँगा कि एक वंडरफुल इम्पैक्ट है उनका हमारी लाइफ्स के ऊपर, हमारी कैरियर्स पे एक एक्सीलेंट रोल है और अभी तक है. उन्होंने हमें सिर्फ प्रोफेशनली और एकेडमिकली ग्रूम नहीं किया, उनकी सबसे बड़ी क्वालिटी ये थी कि उन्होंने हमें एथिकली भी ग्रूम किया. सो आई रिक्वेस्ट ग्रेट अप्लॉज फॉर प्रोफेसर अजहर. So whatever I will talk in front of my teachers, as I said, bit nervous. So please, from teachers, I request that please forgive my shortcomings in the presentation. And secondly, this is just a revision. We all know this. I'm sure you people know much better than me. This symposium and seminars are basically meant for postgrads and undergrads. So we put it some basic things, because if physiology is strong, and this is what our teachers told us, and we obey that if the physiology is strong, the pathology can be managed much better and can be understood much better. So to start with your permission, sir.
Please, sir.
So on ground, when we move uphill or we move downslope, similarly, so many life experiences really, so many life experiences we see, we observe, or we have done it ourselves. So this is how we maintain our balance this way. Then is the roller coaster experience. Those who have enjoyed that, a lot of turns, acute angles, ups and downs, and people still screaming and enjoying. So if we really wonder why this all happened, is it all granted or there is a big physiology working behind it, then we have an inherent curiosity to understand the physiology of body gait, equilibrium and posture. So we are talking about the basic things. So we know that it is the petrous part of the temporal bone which hosts which keeps the semicircular canals, utricle and saccule. And in addition we have cochlea, but today's discussion is related to the vestibular labyrinth. So it has got, this is the hardest bone and perhaps the most dense one. So it has got a bony end case, the bony labyrinth, which is inside we have got the membranous labyrinth. So the three important things: semicircular canal, utricle and saccule. So what are the major functions and assignments nature has given them is the subjective sensation of spatial orientation. So what do we mean by spatial orientation is our relationship to different objects in reference to space and from object to object. And this is how objects are related to each other with reference. So then obviously what body does it to maintain the upright posture, and then it's obviously we need stabilized eyes to maintain our balance. The vestibular arrangements are basically, they are mechanoreceptors. They respond to motion or they respond to movements. So nature has put them in specific planes. So they are right angle to each other, and technically it is known as, it is going to contain a structure inside which we will talk about. Then we have got the other structure, which is saccule and utricle. Here we have got another unique feature, that is the presence of autocorneal membrane. So semicircular canal, we have two types of, we can classify, either we are dealing with the angular acceleration or we are dealing with the linear acceleration. So when we talk about angular acceleration, we are talking about the semicircular canals. So we will talk about shortly what is crista and what is the crista ampullaris. So if we look at the ampulated end, the canal is coming like this and it ends as an dilatation, and this is known as an dilated part of the semicircular canal or the ampulla. So inside the ampulla it is having this structure. It is a gelatinous structure which contains polysaccharides and mucopolysaccharides and protein meshwork. So it is whole this structure. Then below that we have got the hair cells along with the supporting cells, and then finally the nerve filaments are emerging out of it. So this structure plus this put together, we call it crista ampullaris. So what it does is the movement which will move it. So this is how when we are static, and this is how when we move. We will see shortly some animations, and we will talk about it. As I said, this is for postgrads and keen learners. So just something which you can apply on your patients. So this is known as rule of hand. As I said, it is right angle to each other. So this is, they are put in certain axes. So every canal is assigned with a specific movement. So if you're looking at a patient who is sitting in front of you with his or her left ear in front of you, so you don't need to imagine that how canals are there. So you can see that this will be the arrangement of the canal in such a patient. So some animations we took from net, and this is useful, I think. We have got three axes we divide. This is how it is the movement which are classified in different ways. So either we are dealing with the x-axis, or we are dealing with the y-axis, or we are dealing with the z-axis. So this is how the x-axis is. We call it a roll. We will also see some other animations. You can see then it is the rotation around the y-axis, and then similarly it will be around the z-axis. So what does it mean? So you see shortly. So this is another way of describing how the semicircular canals work. So we have got a movement which will be, I request my postgrads to move with me. If we do like this, which canal is working? Okay. So basically it is no, but actually in terminology it is yaw. So what is this canal for? And then we have pitch. Pitch is when we do like this, so this movement, and finally it is a roll which we go on both sides. Sir Mujib, please, you can correct me right now. Okay. So सर मुजीब के साथ बहुत ज़्यादा बैलेंस के साथ हमारा रिलेशन रहा है, एंड हमने इसके ऊपर एक पेपर भी लिखा है, एंड वी प्रेजेंटेड इन कराची आल्सो मुजीब साहब के साथ. So perhaps he is an authority. So these are the three things we just mentioned. Either we have yaw, or we have pitch, or we have roll. So where from this terminology or nomenclature has come? So it came from the aviation, because human beings are not meant for flying. So the humans are not adapted to such things. So the pilots were much trained, much adapted to know that otherwise they can lead to disasters. So this is how in aviation they were taught the roll, the pitch, and the yaw. So this is another animation, you will see that. So अब आप देख रहे हैं 3-dimensional व्यू है सेमी सर्कुलर कैनाल्स कैसे एक्ट करती हैं once we move. So this is how their orientation to each other, and you're looking at now which canal you're looking at, and what is this rolling function. ये पोस्ट ग्रेड्स के लिए थोड़ा सा अलर्ट करने की. Okay. So after this posterior canal, you will be looking at the anterior or superior canal. So this is known as pitch. So this movement, and then horizontal canal, and this is how we move like this. Okay. So this animation explains that how the fluid moves inside. So there is another concept which is known as inertia. So एक सॉलिड है, स्कल है, एक बोन है. सो बोन जब मूव करती है तो फ्लूइड एक थोड़ा लैग करता है, एंड इट मूव्स लेटर. सो उसका इम्पैक्ट फिर थोड़ा सा बाद में, दैट इज़ वाई वी हैव गॉट द लेटेंसी. सो ये एक जस्ट कंसेप्ट है. अगर फ्लास्क को आप समझें कि ये एक बोन है और उसके अंदर एक फ्लूइड है, सो the flask moves first, the solid moves first, and then comes the liquid or the fluid. So उसका impact जो है वो कहा जाता है कि the more the velocity, more will be the neural input. So this is that's why we call it a rotational speedometer. Now comes to the cellular level. Excitation है एक तरफ और एक तरफ inhibition है. So we all know that the nature has provided the hair cell with a kinocilium and with multiple stereocilia. So towards the kinocilium we have got excitation, and away from it is we have got inhibition. Two types of cells. अगर intensity को देखें तो type 1 जो है ये intense movement को register करता है, और slow movements के लिए we have got cylindrical cells. So let's not forget evils. We all know that evils long ago gave the concept that the semicircular canals work as a coplanar. So अगर एक excite होता है तो दूसरा inhibit होता है. And similarly the concept of giving that ampulopetal and ampulofugal flows. Similarly अगर आपको याद हो तो the degree of nystagmus, first degree, second degree, वो evil से related हैं. Then comes the other sensory organ, that is the otolithic organs. And in otolithic, obviously, इसलिए कहते हैं कि uniquely they have got the crystals inside. So आप लोगों के residents के याद रखने के लिए कि कौन सा structure कैसे placed है, मैंने सोचा कि आपको just एक कुछ चीज़ याद रह जाए. U for utricle है और U for upright है, just for to remember. So the utricle will be placed like this and it will register different movement. Now we are talking of linear acceleration. And similarly S for sacule and S for slant. So अब आपको याद रह जाएगा कि utricle upright है और S slant है. So these are the two important structures. और ये इसकी आप example, जैसे escalators में हम up and down जाते हैं, we are static but still we feel that we are moving. So gravity का effect, or similarly once we are driving a car and we have to apply abrupt brakes, then obviously we move like this. So this is also the function of these otolithic organs. We will see how they work. Electron microscope के साथ आप देख सकते हैं कि they are arranged in different rows. Can I ask resident, if we have got one gynoecilium, how many stereocilia we have? Just a guess. Anybody? Residents, please. कोई एक guess, कोई तुक्का लगा दो. If it is one gynoecilium, how many stereocilia? 70. It's about 60. So it's a beautiful animation. You will see that how the sacule and utricle have got inside. There we had a structure which was known as scapula. Here we have a structure which is known as a macula. So यहाँ पे आप देख रहे हैं कि hair cells हैं embedded in the gelatinous membrane, and on the top we have got calcium carbonate crystals. So this is how they move. Again here also it is the same inertial drag which we talked about in the semicircular canals. यहाँ पे भी आप देख सकते हैं इलेक्ट्रॉन माइक्रोस्कोप से ये कैसे. Then यहाँ पे ये neuronal activity है कि how they get excited. So see here, now if the movement is towards the gynoecilium, see the excitation. Lot of neuronal activity taking place. If it goes away from the gynoecilium, then the activity is least. So the vestibular nerve activity is generated. You can see how fast it is towards this way, and then if it goes to the opposite side, it will be the least. It does not mean that semicircular canal sleeps at all time. This is one system which cannot be put off. It is always active. And because we are facing the gravitation, tilts and so many things, so all canals are at least एक resting potential है जो कि हमेशा रहता है. So can I ask another question? How many spikes per second? कोई any guess? अभी तक तो कोई guess नहीं आया. ये टीचर्स का ये प्रॉब्लम होता है, दे कीप आस्किंग क्वेश्चन, प्लीज डोंट माइंड, लेकिन आई विश यू पीपल गेट इन्वॉल्वड इनटू इट. ओके, सो फाइनली अब एक्शन पोटेंशियल जनरेट हो गया, न्यूरोनल एक्टिविटी ट्रांसडक्शन का प्रोसेस हो गया, अब उसने आगे प्रोसीड करना है. ठीक है, सो नर्व फिलामेंट्स विल मेक द नर्व, द वेस्टिबुलर नर्व्स, एंड देन दे गेट यूनाइटेड विद द कॉक्लियर टू मेक द 8th cranial nerve. अब उसके सामने एक सबसे पहले जो चीज़ आएगी वो गैंग्लियन आएंगे. व्हाट इज़ द नेम ऑफ दिस गैंग्लियन? Anybody? Ganglion का कोई नाम है? So it's I think it's Scarpa's ganglion. So sir, यहाँ पे you can see that this is how the inputs are coming. The ganglion, और ganglion के बारे में है कि perhaps it is 20,000 nerve fibers there. So यहाँ से इन्होंने अब they have to reach in the previous diagram you see that it is the pontomedullary junction, the pons and the so इस junction के ऊपर हमारी 7th और 8th nerve जो हैं they enter the brainstem. Now you see from here we have got 4 nuclei, and from these nuclei multiple tracts are being generated. So these tracts will go vestibulospinal, they will go vestibulocerebellar, they will go up towards the 3rd, 4th and 6th nerves, and then they go to the vestibulothymus. So thalamus एक ऐसा structure है जो कि कहते हैं कि 98% तक sensory informations को cortex तक पहुंचाता है. So it is not only the vestibular system, it is the vision, it is the taste, and it is the touch also जो कि thalamus से. And finally we have got in the parietal lobe, we have got this vestibular cortex, और उसके साथ हमारा olfactory भी है, gustatory है और दूसरे areas हैं. Then अब afferent चले गए, अब वापसी होनी है. How we maintain the balance now? It's not all that is granted. एक पूरा reflex system है जो इसके साथ move करता है. And that is the vestibulo-ocular reflex, that is the vestibulo-colic and vestibulospinal. These are some of the main reflexes. So इसमें सबसे जो famous है, जो बहुत ज़्यादा हम लोग जिसके बारे में जानते भी हैं शायद, that is the VOR. Whenever we move, when we are walking, jogging or sports activities, how we maintain the eye gaze. So we need to have a stabilized gaze if we are running, otherwise we cannot really maintain that activity. So ये vestibulo-ocular reflex. अब vestibulo-ocular reflex को हम कैसे elicit करते हैं, कैसे इसको check करते हैं? We all know that we have got a Hent's examination. HI stands for head impulse, and N stands for nystagmus, and T and S stands for test of skew. So the skew deviation, nystagmus and head impulse, they put together makes a Hent's examination. Hent's examination हमारे लिए useful है during examination because एक तो ये हमें peripheral और central pathology से इस level पे ही बता देता है कि what we are dealing. So this I did on my ward attendant. So just for you people. So it will be the saccards which will come, or otherwise if the central pathologies, then it will be a different presentation. So basically हम क्या कर रहे होते हैं? It's the इसका दूसरा जो है वो oculo cephalic reflex है जो कि doll's eye movements भी जिसको कहा जाता है. So then is the vestibulocolic, इसमें neck muscles आएंगे. Then is the vestibulospinal, इसमें again हमारे skeletal muscles कैसे हम gravity anti-gravity muscles को deal करते हैं. And then we have postural reflexes, the tonic labyrinthine and labyrinthine brightening reflexes. So to make a summary, we all know that we have got 3 important inputs, and that is the vision, that is in the center we have the main system, and then we have proprioception. Proprioception हमारे tendons, ligaments, joints, touch sensation, इससे जो activity आती है वो हमें तीनों put together, they reach to the higher centers, integrated there, and then the afferent comes back. This 3 put together, we maintain our balance. So to conclude, as I said, we have got these inputs, then it is the integration made at different levels, and then is the efferents coming out, making the motor inputs and reflexes put together to maintain the balance in a proper way. So thank you very much, Sarfraz and your team. You have made a wonderful morning for all of us. सबसे बड़ी बात मेरे लिए honor की ये है कि all my teachers sitting in front of me, और स्टूडेंट्स के लिए भी ये एक जेस्चर है टीचर्स का आप लोगों के लिए भी. Please maintain this respect for your teachers. Always join academics whenever, wherever possible. And Sarfraz is one person who is actively doing this, and we should always support him. And this picture is from CPSP last examination. Sarfraz perhaps shared a joke with me. Then he kept only smiling, but I could not control my laughter. So this is the picture of that. And then thank you very much. So I believe that we should also maintain a good balance in our life, and it is the matter of rhythm and harmony and all this. Thank you very much once again, Dr. Anwar, Dr. Naeem, Faisal, Sarfraz, Manzoor Saab, Najam Saab, Mujib Saab, Khurshid, Tahir, Imran, Brigadier Atik, and all my Nukbat and all friends who have joined this morning. I hope this presentation, which was just a basic physiology, something I think we can remember out of it and apply this knowledge when we are clinically dealing it. My great teacher will be talking about it. Khurshid has a presentation today. So Tahir, all inshallah we will try to make as much possible. Mujib Saab हैं जो कि expertise हैं इसमें. So we wish that you learn out of it. Thank you very much once again.